Okay, let's discuss now another group of anemia, the hemolytic anemia. So hemolytic anemia, here the problem is the erythrocytes have shortened lifespan. So instead of 120 days, so dili mo abot to, hindi aabot sa 120 days. So meaning dili pa gani di pa time nga magbuhat og bag-ong red blood cells ang atong erythrocytes namatay na. So ang nahitabo kay wa pa may nabuhat nga bag-o nya namatay na. So naibanan ang ilahang numbers. So meaning nag-anemia ta due to the destruction of the red blood cells. That's the hemolytic. This from the word hemolytic. That's hemo, that's blood. Lytic is lysis or destruction. So we have here an anemia due to the destruction, more than the necessary. Okay, so marked destruction of red blood cells resulting to a decreased number of circulating red blood cells. Okay, which causes now the anemia. And because of this, bone usually able to compensate partially by producing new red cells at 3 times or more than the normal rate. Pero kung mo na gibuhat sa bones, dinalian, okay? 3 times or more than the normal rate. So, meaning nagdali siya buhat kay nakuwangan naman ang red blood cells nga nag-circulate. So, nagbuhat og bag-o nga red blood cells ang imuhang bone marrow. Pero, sa dinalian nga paagi. So, what will be the effect? 1. Increase in reticulocytes, meaning they produce red blood cells but dili tanan mature. So, there are immature RBC. So, when we say immature, it cannot really perform the function of the red blood cells. So, wag hapoy gamit. And fraction of indirect or unconjugated bilirubin is increased because since it produces immature red blood cells. So, dali ra gyapon na mabungkag. Now, this is what happened if your red blood cell will be destroyed. So, ang mahitabo, inig mabungkag ang red blood cells, ang imuhang hemoglobin will be broken also. So, the hem, no? From the hemoglobin, the hem or the hemi and the globin will separate. So ang hem ang hem is the yellow or the brown pigment found in the hemoglobin. Okay? The globin is the protein. So pagkabungkag nila, si hem ang color, mungadto na siya dapat pauli sa imuhang liver. Okay? So pag mabungkag ang imong red blood cells or ang himong hemoglobin na natay hem. So kana si hem or hemi, mo na siya ang indirect or unconjugated bilirubin. So ang destination na niya supposedly ngadto na siya ni liver. Kay once paabot na siya ni liver, si liver i-process na siya, okay? Mahimo na siyang conjugated. Okay? Bilirubin 2. Kaya ang imong unconjugated mo na si bilirubin 1, si B1. Then, i-process na, pag-abot sa liver, i-process na siya, himuo na siya nga bilirubin 2. Conjugated na. Medyo, in other words, simplified na siya para i-appeal na siya nga to sa imong bile. Because your bilirubin, that's what gives color to your bile. And this is one of the major components sa bile nga naa sa imong gallbladder. Okay? So kung mas daghan ta og nagbungkag nga red blood cells, mas budaghan ang atong unconjugated bilirubin. Kay take note that unconjugated bilirubin is the product of RBC breakdown. Then haptoglobin or the binding protein for free hemoglobin is low since we have an increased destruction. Then the bone marrow is hypercellular with erythroid proliferation. When you say erythroid, this is the stem cell for your erythrocytes. So mo ni ang murag parent cell ni RBC. So since nag-apas man si bone marrow to cope up with the deficiency nato sa red blood cells, so ang mahitabo mas mudaghan ang imuhang erythroid ngadto. So upon examination under the microscope, so mo na ito makitaan. So hypercellular, bigger than the normal. So we will be comparing now what's the difference between erythrocytes and reticulites or reticulocytes? So this is your normal red blood cells. That is your erythrocytes. The other term of your the medical term for your red blood cells, erythrocytes, versus the reticulites. Now, among reticulites, they are immature red blood cells. If you notice, your red blood cells, the mature red blood cells, are biconcave in shape. So, mura na siyang donut. Again, why? So that kaning imong red blood cells makasud ni sa imuhang mga pinakagagmay nga blood vessels nga di siya mabroken, di siya mabungkag. Kay pwede mo na siya imong number 8 ni mo, pwede na mo twist, pwede na mo inaton because of the concavity sa tunga, making this elastic. Dugay mabungkag bisan pag musuot-suot na siya sa mga ginagmay nga agianan. Whereas ang imuhang kani, this is your normal red blood cells. Okay? But this is your reticulocytes. Abnormal, immature, and dili biconcave. Mura na siya puparihan nagtanawan nimo og si NIPS or si M&M. Nga when it musud na angat to sa gagmay nga mga agianan, tendency mabungkag na sila because wala man siya concavity like your erythrocytes. So that's the difference between the two. Aside from the anatomy, they also differ in physiology. Dili man ka carry og daghang oxygen. Okay? Kaya immature man siya. So kuwangan siya og anatomical structure. So manang although natay nani wag hapon na siya gamit. It does not carry oxygen at all. So first in line with your hemolytic anemia is your hereditary spherocytosis. This is an autohemolytic disorder. When we say autohemolytic, meaning it's your own immune system or your own body is destroying your red blood cells. So autohemolytic disorder characterized by small sphere-shaped red cells and splenomegaly. So what happens here is that, okay, again, this is the normal biconcavity. Pero kung na kay spherocytosis, your spherocyte, instead nga murag donut shape na siya, sphere shape ng ato, lingin. Mura siya og kuan, mura siya og kining julin. No, murag julin ang imuhang red blood cells instead nga murag donut. Kay wa siya concavity. Okay? So, what will happen here is because of the form, again, like your reticulocytes, pag niya sa mga gagmay nga mga kuan, mabungkag siya. Because, ang difference nila is the protein that makes up the red blood cells. Okay? Particularly the cytoskeleton is complete sa imong normal. But sa imong spherocyte, defective. So, manang inana iya porma. Then, nganong mag-explain yung may gali? Kay because kung daghan tagin ani nya dali ra man siya mabungkag kay fragile man na siya, di ba para ani nga pwede nimong ning likis-likis kung imo siya nga i-twist nga di mabungkag kani once maipit bungkag din siya. So, kung daghag mamatay nga spherocyte or red blood cells, ang ilahang destination, ang cemetery na nila imong spleen. So the more RBC nga na-destroy, the more nga mapuno ang spleen. So ang end result is that the spleen will enlarge. So enlargement of the spleen is called splenomegaly. And this type of hemolytic anemia is an uncommon disorder inherited in a dominant fashion. What do you mean by dominant fashion? So meaning the both parents have a genetic disorder relating to spherocytosis. It may be ang father nakakuha sa genes nga maybe dili dominant, no, recessive genes. When say recessive, na ay defect ang iyang genes pero wa gina-display. So that's a negative, recessive. And then the mother is also having recessive genes. The same with related sa spherocytosis. Now, based on even in our algebra, di ba? Negative plus negative, it will become positive. So, si mama na recessive genes sa spherocytosis. Si papa na recessive genes related to spherocytosis. So, pag kabuhat nilang bata, ang recessive plus recessive, it will become dominant. So, it's now the offspring ang mag-display. So, manang gitawag na ito in dominant fashion. Okay, what will happen here is that now, the red blood cell membrane lose its elasticity as they pass through the spleen. Kaya kasagaran ka ng spleen, mo na siya nag-usan na sa filter, no? When first nga agian sa imuhang red blood cells. Now, kung normal ka nga RBC, why kay problema? Kay elastic man ka, bisan pag magkalukot-lukot ka nga ito pag-agi mo sa spleen, di ka mabuak, di ka mabroken, di ka ma-destroy. Pero kung si spherocyte ka, di man ka makaibay concavity, di man ka murag donut. So pagkaso ni mo ngadtong mapasla ka sa mga gagmay nga tong agianan, bungkag ka, mabuak. Okay? So you lose the elasticity. So dali ra mabuak. So ang resulta, destruction. So there are 3 things nga mahitabo kung mabungkag ang imong RBC. Okay, 1, of course, mabungkag mang RBC, there is a decrease in the number of circulating blood vessels. Kinaibanan man. Then, as I've said, ang imong mga patay nga RBC, tuwa man na ipundo nga to sa imong spleen. So the more nga RBC ang ma-destroy, mapuno ang imong spleen. To the point nga mo enlarge na siya. And we call that one splenomegaly. Enlargement of the spleen. Then the patient may also have jaundice. Katong mag-yellow ang panit. Ngano man? Kala ko sir, liver problem lang ang mag-jaundice. No. Again, let's go back to hemoglobin. B1, B2. Okay. Diba? Pag ma-destroy ang RBC nimo, mabungkag si hemoglobin. Si hem mahimong unconjugated bilirubin. Yellow na siya color. Okay? So, if small amount lang ang ma-destroy ng RBC, kaya na ni liver si unconjugated bilirubin tangtangon sa circulation. Okay? Dapat tangtangon na si unconjugated bilirubin sa circulation, si B1, para i-convert na ni liver into conjugated or simplified bilirubin, making it bilirubin 2, the B2. So once mahimo na siyang B2, ang buhato ni liver, iyan na ipadanga to sa gallbladder para isagol sa bile. Okay? Ang bile nimo is yellowish or greenish in color. Okay? Now, if daghan ang na-destroy na RBC, so daghan pod ang gi-conjugate na nga bilirubin ni liver. Now, if moabot na sa punto nga ang liver saturated na, puno na si liver o conjugated bilirubin, no? Puno na siya sa B2. Kay puno na pud ang gallbladder. So tuwa na standby nga conjugated bilirubin. Kay tuwa na tambay nga B2. So kung naapay B1 mo abot, balibaran unay na ni liver. Siya di unay kumudawat kay puno pa mi. So tuyok lang unay apil. So go back to circulation. Okay. So kung managhan na sila pag-ayo sa circulating blood ang kanang mong B1 and conjugated bilirubin, what the body will do is that iyan na i-deposit sa imuhang skin o sclera. Okay? Sa imong skin, no? Sa imong sclera except sa brain. So, ang sclera sa puti sa imong mata. So, magtikadaghan ang atong unconjugated bilirubin nga naa sa circulation, magtikadaghan ang i-deposit sa to skin. So, pag daghan na gaya ang na-deposit sa to skin, mo na nang makita na nato ang color niya. Mo na nang jaundice. Yellowish discoloration. Not because kay daot siya liver. Take note class ha. Remember this. Ang jaundice tulo na kaklase. Prehepatic, meaning nag-yellow na siya because ang problem before sa liver. So meaning outside the liver. So ang aton jaundice nga re sa ato ang hemolytic anemia is prehepatic because the cause of the jaundice is the one outside the liver. Okay? It's not the liver. Sa kani nga jaundice, kani nga nagilo, dili ang liver may problema. Nanubra ang imong unconjugated bilirubin, ang imong B1. Okay? So that's prehepatic. May nga kag intrahepatic jaundice, kana ang problema nato ang liver mo'y daot. Bisag normal ra ang imong B1, ang liver daot di niya makonjugate. Mo nang magpabilin ang unconjugated bilirubin sa circulation. Mo nang magjaundice kay ang liver mo'y daot. Sa ika-third is post-hepatic. Normal lang atong bilirubin production, normal lang amounts tong B1, okay. Okay kayo si liver. Ang problema na to, kung post-hepatic, ang problema to ang imong gallbladder. Kay ang bile sa imong gallbladder di ma-release na to sa duodenum. Okay, dili magamit. So pagkapuno sa imong gallbladder, mapuno to backflow. Bubalik siya padong sa liver, pagkapuno ni liver, mubalik pagawas. Jaundice gyapon. Okay. So again in here, the jaundice nga nahitabo sa ato ang spherocytosis is prehepatic. Because what makes the yellowish discoloration obvious of the skin of the patient is due to the deposit of unconjugated bilirubin because of the marked increase of destruction of RBC. Then, if there is decreased red blood cell circulation, of course, decreased circulating RBC is clinically known as anemia. So, mo nang nasold sa ani nga category. So, it is manifested by peripheral blood contain many of the characteristically small spherical cells. So, katong imong spherocytes. So, in this type of disorder, dili lang tamo kuhag CBC ha. We have to request for peripheral smear para tanawon ang morphology, meaning the anatomy, how the structure of the red blood cells in the peripheral area of the body. So kung nakay hereditary spherocytosis, kasagaran makita na to ang spherical red blood cells. Then anemia that may be exacerbated by infection. So nakay anemia daan, pero pag mag-infection ka, mas mugrabe siya. Then splenomegaly, enlargement of the spleen. And disorder is diagnosed during childhood, but may be missed until adulthood because of the few symptoms. Now, since it is hereditary, kasagaran makuha na siya during childhood. Pero kung okay lang iyang symptoms, minimal lang, di kayo na feel sa patient, maybe pag abot na niya mga high school na niya ma-detect. Particularly if babae, nato naman ma-detect kung nag-menstruation na kay ma-exacerbate na po ang iyang anemia. Okay, how it is being managed? So, since, di ba, tuaman ang destruction sa spleen. So, we might as well remove the spleen because there's no such thing as correction for this because it's hereditary. No, it's genetic. And if ang atong reticulocytes dili mo pass through your kining spleen, so minimal ang atong RBC destruction. So the solution is we have to remove the spleen. So splenectomy. Then major complications prevented by splenectomy. So what are the complications nga malikaya nato kung mag-perform tag splenectomy? Aplastic crisis after infection. You know what is aplasia? Absence or there is a marked decrease of the three components of your blood. The red blood cells, the white blood cells, and the platelet. That's your aplastic crisis. Non-healing ankle and leg infection. Again, less ang red blood cell, so less ang mag-carry sa nutrients o sa oxygen. If there is an injury on the distal portion of the body, mas lesser pa ang moabot nga materials for tissue repair sa injured area because less ra atong RBC. So, gamay rag madana to nga pang-repair. So, kay gamay raman ang madana to nga pang-repair, hinay mo ayo ang samad. To the point nga maabsanta sa infection. Gallstone. Diba, min ko ganina? Daghan ra kaayo ang unconjugated nga mahimong conjugated nga bilirubin. So, if that is the case, mas concentrated imuhang bile. Meaning, espiso kayo imong bile, espiso kayo imong abdo. Tungod sa espiso sa imong abdo, pwede na mugbagtok, forming now gallstone. Okay? So, magka-cholelithiasis na po ka. So, mana sa gallbladder stone. Because of the very concentrated bile due to increased number of bilirubin. Next is thalassemia. Thalassemia is a group of hereditary disorders associated with defective hemoglobin chain synthesis. So, ang problema nato diri, namatay duha ka group of hemoglobin chain. So, may kag thalassemia, it's either one of that chain or chains absent. So, defective hemoglobin chain synthesis. Characterized by hypochromia, pale nga red blood cells, na kay RBC pero luspad. Microcytosis, you have an RBC which is smaller than the normal size. Hemolysis, destruction of RBC, and variable degree of anemia. So let's classify thalassemia. So first we have the alpha thalassemia. Okay, when you see alpha thalassemia, associated with defect or absence of alpha chain synthesis of hemoglobin. Okay, this is your alpha chain. Alpha chain. This one, the orange and the violet one. So, duha man na. Duha ka alpha, duha ka beta. So, kung may ka og alpha thalassemia, kaning duha, kani mo'y absent. It's either absent or, kung present, defective. Occurs mainly in people in Asia and Africa. So, affected tani. But, unfortunately, bahalag affected ta, it's a milder form. And, pwede, often without symptoms. So, okay lang. Then we have the other one, the beta thalassemia. So, with defect or absence of beta chain synthesis of hemoglobin. So, this time, kanalapod ang it's either naa pero defective, or it's either ang usa absent, ang usa present, or kompleto pero daot, it's either ang usa or ang duha. So this is your beta chain hemoglobin. So this type of thalassemia occurs mainly in the Mediterranean population, like kanang nasa France, Italy, no, sa Greece. So muni nga to sa ila na. And patient with severe untreated thalassemia will die within the first few years of life. So between beta and alpha, mas grabe-grabe ni si beta. Okay? So if di kuno ka matreat for the first few years of life, you will not survive. If treated with regular transfusion, pastilan, they may survive into their 20s and 30s only. So it's very difficult because it's genetic, no? You cannot live forever by transfusion because if there is frequent transfusion, there's always the side effect and the reaction. Pwede ka mag-iron overload. So, daghang kag problema. So, manang di sila magdugay. And usually, one of the leading cause is heart failure. Madaot naman yung kasing-kasing ani nila. Okay? It would result into congestive heart failure. Left-sided. Okay, classification of beta thalassemia according to its severity. Take note, it's beta thalassemia since the alpha could be milder or even without symptoms. So, nga rito sa beta. So, according to its severity, could have thalassemia minima and minor. Okay? Pag thalassemia minima and minor or minor, it's asymptomatic. No signs and symptoms at all. Then we have thalassemia intermedia. So more severe with life expectancy of only 3 to 4 decades. So nanasaygi paminawa ni na simptomas niya if proper management makaabot siya og 40 years old. And most of them suffer from chronic fatigue because of the decrease in the circulating red blood cells. So imagine na every whole year round kuwangan kag RBC. So all whole year round kuwangan ka og oxygen. All year round mag-hypoxia ka. Debilitating bone pain. Because of the decrease in number of red blood cells, ang compensation sa imong bone marrow is to produce more. So mag-hypercellular to siya dito. Maghuot na, causing now bone pain. And since, di ba, mo compensate man si heart pagbeat. So maybe 3 or 4 times more ang iyang workload to cope up with the demand. So in the end, ay mo ang left ventricle will fail, resulting into could be left ventricular hypertrophy or left ventricular failure. Yeah, magka left-sided CHF na ka. Hypersplenism because of the increased number of destruction of red blood cells. Daghan man, sige man kada adlaw, daghan mabungkag nga RBC. So, mudako ang imong spleen, mag-splenomegaly, or also known as hypersplenism. And we often have iron overload which is worsened by transfusion. Nganong mag-iron overload man ta? Inani man ni, pag mabungkag ang imong hem, no? Si hem na siya iron. Ang malabay ra si hem, pero ang iron dili. Si globin okay ra si globin kay gamiton magbalik ngadto kay si globin maman ng protein. So gamiton na siya balik pag-produce. Pero ang iron nato magsige tag ka-destroy og red blood cells, ang iron di malabay. So mapundo na ngadto sa atong lawas si iron. I think it's hypersiderosis ang term ana. Which is not good because it could cause another problem. Okay, next we have your immune hemolytic anemia. Now, this is something to do with your antibodies. Okay, when antibodies combine with RBC, so kung ang antibodies, so ato i-combine sa mga red blood cells, it can be either of the following. Isoantibodies means reacting with foreign cells as in blood transfusion reaction or erythroblastosis fetalis. So, may kag-isoantibodies kana bang mag-abono ta og dugo nga gikan sa laing tao, kay pwede day mag-abono sir og dugo nga gikan nako? Yes, we can. That is what we call autotransfusion. How? Pwede na siya buhaton nato. Let's say example, you are scheduled to have a surgery 2 weeks from now. So, pwede ka mangadto ka sa Red Cross, may ka ma'am, magpakuha ko dag ako dugo. Okay? Because operahan ko after 2 weeks. So, magpakuha ko daan, kay in case after or during or after surgery, manginahanglan kog dugo, na ako'y dugo gipundo diri. So, that is an autotransfusion. That's that's the safest way to transfuse blood because you're transfusing your own blood. Imong kaugali yung dugo, imong giabono. Okay, pwede na siya metabo ha. Pwede ka magkuha daan og dugo nimo for future use. Imo lang na i-store ngadto sa blood bank. Okay. Pero ang atong kasagaran hitabo diri is we use the blood donor. So kasagaran natay reaction kay mag-abono kitag dugo, you're introducing another foreign object, another protein. Okay? Another protein which could trigger immune response. So, kung ang imong immune system mo react sa blood nga gitransfuse nga gikan sa laing donor, sa laing tao, mo na gitawag itong isoantibodies or Erythroblastosis fetalis, di ba? I hope you can still remember katong Rh negative and Rh positive mother and child, di ba? Pag si child nagka gets in contact nga si Rh negative child, then si Rh positive or Rh positive si baby, Rh negative si mama, pag nag-meet ilang blood, it would result into erythroblastosis fetalis. Since the immune system of the baby reacted to the Rh negative blood of the mommy. So that is iso antibodies. But it could also be O2 antibodies. When you say O2 itself, automatic. Sumingag automatic, waka di na nimo hilabtan. Moon ra by itself. Muna, diba ka? Wala ka balaka, automatic na siya. So meaning, kung ka automatic na mo open, meaning it open by himself or itself. So, auto-antibodies is self-antibodies. So when we say self-antibodies, it react with the cells of the host. In other words, ang imong antibodies will react to your own cells. Ug mo react na nga to sa kaugalingon ng nimong red blood cell, amo na nagitawag na to immune hemolytic anemia by auto-antibodies. Okay? So, ang imong kaugalingong antibodies is now attacking your own red blood cells as if di sila kaila. So, antibodies coat the red cells. So, how do we know nga naay antibodies ang imuhang cell? By positive Combs test. And hemolysis that results may be very severe. Kay unsa may mahitabo sa immune hemolytic anemia? It's either isoantibodies or autoantibodies o saray nahitabo diri. Ang imuhang antibodies wa kaila na kung kinsa na iyang giatake. Sa isoantibodies is natural. For example, transfusion ta ka og dili nimo kapareha nga blood type. Tamor sinumbagay guna sila ngadto kay di mo pareha og blood type. Ba? So mas magsinumbagay na sila. It's normal kung abunuhan kag dili compatible. So daghang gyud ang mahitabo na kay kung iabunuhan kag dili compatible, it mix with your own red blood cells. Usahay di nila na bisag kaila pa na imong antibodies nga ato ni kauban, but namatay gitawag collateral damage. Kana bang kakuan kag nagsinumbagay imong silingan nya rakas kilid na igo ka. That's what we call collateral damage. So bisan pag iso antibodies na siya, it could still result into hemolytic anemia. The more if it is autoantibodies, hemolysis good severe. Kaya nga naman, imagine your own antibodies attacking and killing your own red blood cells as if they don't know each other. As if wa sila magkailhanay. Okay? So manang grabe ang hemolysis nga mahitabo. And usually an idiopathic autoimmune state. When we say idiopathic, unknown cause. In other words, a disease of its own. So, kung pangutan mo sa nito, I don't know what happened. It just happened. Manang ito idiopathic. Idios from the Greek word meaning dili unknown. Okay, unknown. So idiopathic. So usually an idiopathic autoimmune state. You could be normal, then suddenly your immune system wa naka-recognize sa imong RBC. It could happen, okay? Because it's idiopathic. Okay, clinical manifestation could be ato ra siya ma-check by using the Combs test. So if you have positive Combs test, there is an immune reaction to red blood cells. And Combs test comes into two types. Could have direct antiglobulin test or DET. Pwede mo direct Combs test or also known as direct antiglobulin test or in short DAT. So unsa man si direct? So ang mahitabo dire kani siya si direct COMS test used to detect if antibodies or complement system factors have bound to RBC surface antigen in vivo. What do you mean by in vivo? Within. Okay? So, kung nagsuspekta nga itong pasyente na auto kining immune hemolytic anemia, we're going to extract patient's blood. So, blood sample from patient with immune-mediated hemolytic anemia. Kay if nagsuspekta nga tingalig immune hemolytic anemia ni siya, so magkuhatag blood niya. And antibodies are shown attached to kana. Sa kasagaran pag nakay di ba in vivo. So meaning it's autoimmune. It's your own antibodies na tanawa. It's your own antibodies attaching or attacking your own red blood cells. So if you want to know if kana bagyong imo antibody mo'y nakakos sa imuhang destruction sa RBC, or if we want to know nga naabay antibodies nga mipilit anang imong mga RBC, ato na patud-an og COMS reagent. Okay? Ano siya gitawag anti-human antibodies. Now, if tinuod man gani nga naay imong kaugalingong antibodies nagpalibot ana imong red blood cells, kung patud-an nato og COMS test, ang mo resulta is positive test result, which means human natog pato sa imuhang COMS reagent, ang imuhang blood magkumpol-kumpol na siya. There is agglutination, magkumpol-kumpol, magsikit-sikit. Meron siya og murag nagpundok-pundok. Imbis ka ganina kung ara kay to siya, okay ra kay ang consistency, karon magpundok kay na nga naman. Kay kung naa na siya antibodies gyud nagpalibot sa imong RBC niya, patud-an nato COMS reagent, magsumpay-sumpay na sila ang imong mga antibody because of the COMS reagent. So manang magkumpol-kumpol na siya. So if magkumpol-kumpol, positive ka sa COMS test, meaning na ang imuhang red blood cells is being attached by your own antibodies. Kay kung wa na antibodies diha, tinigpato na to ani, dili na magkumpol-kumpol, then negative ka. Okay? That is in vivo. Your own blood is being tested. That's direct. Then we have the indirect COMS test, or your indirect antiglobulin test, or your IAT. So what we perform here is that we use it to detect in vitro antibody antigen reaction. When we say in vitro, outside. So meaning we will be using now a patient's plasma and a donor's blood, or a patient's blood and a donor's blood, ato i-mix. Okay? Yan, tanawon nato kung di ba sila magkumpol-kumpol. Kaya mo nakita in vitro because we are using something from outside the body, which is the donor's blood. So, mo ning gamito nato class if atong pasyente abunuhanan, di ba? Kung mag-abuno kay tag dugo, dili lang takutob la sa blood type. Bisan pagpareha mo blood type, sige si ako positive ko. Then mo-donate ka na ako o positive ka. It doesn't mean nga sige pareha mo blood type, confirm sa lab pareha ta o plus pag-donate nimo, pag nanatay dugo, transfuse dayon. No, di pa. Bisan pagpareha ta o blood type, before na siya i-transfuse, i-check onay nato ang imuhang indirect COMS test. Ang other word ani is cross-matching. Meaning, ang imong blood o ang akong blood i-mix, tan-awon nato og unsay mahitabo by using COMS reagent. Okay, so ngari, recipient serum is obtained, meaning ang imuhang kung for example ako ang mudawat, so magkuha silang ako dugo. Okay? So, sa akong dugo, makuha po nga ito ako antibodies, right? Then, mix it with donor's blood. So, pagpatakan akong dugo, Patakan po sa patient's or sa donor's blood. Okay? Then, mag-mix na sila. So, kung naay inigmix nato sa akong blood o sa imong blood, naga ni antibodies reaction, meaning naga antibodies reaction, naay antigen nakita na akong immune system. Meaning, kung naay antibody ma-produce pag mix sa atong duha ka blood, meaning ang akong immune system mayon nga oy di pwede. There is something wrong with that blood. So man ang naay antibody na produce. Pero di man nato makita ano ato tanaw-tanawon lang. So one way to confirm if there is a reaction between your blood and my blood which result in the production of antibodies, ato patud-an siya og Combs reagent. If indeed, kung tinuod yun na ang akong blood, bisan pagpareha tag blood type, pag mix, na ay antibodies na produce ako immune system kay wa siya ganahi sa imong blood. Pagpatakan na nato sa imong Combs reagent, ang mahitabo mahimong positive test result. Again, magkumpul-kumpul. So in that case, sa may buhaton, dili iabuno ang dugo. Kay ang akong dugo mi-react sa imuhang dugo nga dili na pwede. Supposedly, kung mag-donate, ang donor's blood cannot trigger any antibodies to the recipient's blood. Okay? So that is your indirect Combs test. So ayaw nagkalimtip ha, para inig maabot na mo og higher years, mangutana nganong magpa-check pa man kog cross-matching nga pareha mamig blood type. Ang pag-check sa blood type is to know if pareha ba mo blood type. Pero even though nga pareha mo blood type, naa pagi possibility nga mag-react ng imuhang blood sa i-donate nga blood sa imo. And to make sure nga kanang i-donate nga blood sa imo, dili mo react ang imuhang kaugalingong blood, ato na siya i-test unay og indirect Combs test or makakadungog mo later i-cross-match unay na. Manang i-cross-match tawa. I-cross-match sila so that we will know if there is antibodies produced. Gets? Hopefully. Okay. Then, aside from the positive Combs test, direct or indirect, patient will display signs of anemia, like fatigue due to hypoxia, dyspnea, as a compensatory mechanism of decreased circulating oxygenated blood, palpitation because of the increased cardiac workload to compensate with your hypoxia, jaundice because of the increased destruction of red blood cells resulting to increased concentration of your unconjugated bilirubin. And occasionally, the anemia is so severe with the overwhelming hemolysis and shock. So, mo na nang mamatyan sa itong pasyente. Mag-cardiogenic shock. Anong mag-cardiogenic shock man? Stop na ang heart o pump because what's the use? Gamay na lang ang red blood cells. Okay, how it is being managed? Any possible offender should be discontinued. For example, ang offender nato katong gi-transfuse nato nga dugo, then stop the transfusion. Mabito nang kung pag-transfuse nato later, hopefully I think I will discuss blood transfusion if we have time. Manainig mag-transfuse kay tag blood, di nato biyaan nato pasyente kay for the first 15 to 30 minutes kay naa nato makit-an diha maobserbaran kung nabay reaction. Kay kung mag-react atong pasyente sa gi-transfuse nga blood, it should be automatically discontinued. Okay? Ay na pananghit sa doktor, i-discontinue na lang na then inform the doctor later nga dok ako gipaong kay money na hitabo sa atong pasyente. Because of di na nato pagnon, mas daghan ang misud ngadto nga blood, mas daghan, mas grabe ang hemolysis which could kill the patient. Okay? So mo nang inana ta ka careful if we transfuse blood. because it could result into immune hemolytic anemia. Then high dose of corticosteroids until hemolysis is decreased. Why we have to give corticosteroids? Because corticosteroids or steroids are immunosuppressant. So it's your own, if kinsa may sad-an ni, it's the immune system ang culprit. Active ra kay siya, sensitive ra kay. So kung si immune system ang sad-an, then we have to ato siya i-tame down. So hatagan nato ang pasyente og kining immunosuppressants to suppress the immune system. Then splenectomy removes a major site of red cell destruction. It is done if corticosteroid do not produce remission. Mean say, bisan pag naghatag na tag high dose of corticosteroids, then nothing change. Mabalik sa normal atong pasyente, then pwede na mag-splenectomy. And if steroid and splenectomy fail, sige, mo yun, madutli sa steroids, madutli sa splenectomy, then maghatag na tag immunosuppressive drugs like the drugs that used to treat cancer. Kanang mga cancer chemotherapeutic drugs. Very, very potent kina sila. Very potent, very effective. Diba? Very effective nga even imong buhok tangtang. Kayon sa inaa sa imong cancer chemotherapeutic drugs, ang iyahan ng target patjon niya ang mga fast multiplying nga mga cells, because your immune system is fast multiplying man siya, paspas sa multiply, but dili man siya specific nya sa atong lawas. Dili ra man si immune system may fast multiplying. Imuhang hair apil man na, ang sperm cell apil, pati mga linings mong ba apil. So mo nang sa nag-chemotherapy nga using cancer chemotherapeutic drugs, number 1, maupaw. Of course, down ang immune system mo nang kabantay mo sa mga nag-chemotherapy, di na sila pagawson kay immunocompromise. Weak ila immune system kay gituyog pa weak kay collateral damage na sa iyang cancer chemotherapy. So, manang tagaan pa ito immunosuppressive drugs. Okay, this is the WHO grading of anemia. So, usually ang atong pag-check sa atong hemoglobin is by grams per deciliter. So, ang normal nato is 11 to 16 or 12 to 16, no? Depende sa gender. So, if naka sa 11 something, 11 grams per deciliter, you're normal. If it is below 11, naka sa 10, you have a mild anemia. If it's 9 to 8, moderate. 8 below, serious. 6 na lang gaya na imong hemoglobin, it's life-threatening. You need blood transfusion. So that is how your anemia is being graded according to WHO, World Health Organization.